Good evening. Good evening and a warm welcome to the Smell Bell Verbal Cephalocervical Surgical ENT Head and Neck information videos just for the matter of understanding ENT. Today we are going to have a small discussion about the acute otitis media. Acute otitis media in the adults. It's not in children, in the adults. Now it is defined as an inflammation of viral or bacterial. It may be viral one or bacterial origin, which is involving the middle ear mucosa and also the mastoid mucosa and mastoid air cell system. So it is purely inflammation of that in acute sense within less than 6 weeks. To especially in 1 or 2 days the infection comes as a upper respiratory tract infection and spreads as a acute otitis media towards the ear. The chief finding is that the patient will be having severe otalgia. He will be having severe otalgia and unbearable ear pain, and which is a manifestation of a systemic disease most of the times. Especially if you take in adults, it is nearly some 15 to 16% of the total patients that are coming as acute otitis media. 16% are adult population, as you can see, and sometimes more common in the case of infections like HIV, that is AIDS, full-blown HIV infection, acquired immunodeficiency syndrome. It is more common as it is associated with that. Here are the Dutch college guidelines that you have to follow for the diagnosis of this acute suppurative otitis media, that is acute otitis media, as you can see. And the most commonest organisms being in adults, it is Haemophilus influenzae as far as the study is concerned, and then Moraxella catarrhalis. Haemophilus influenzae, number 2 is the Streptococcus pneumoniae. Haemophilus influenzae, number 2 Streptococcus pneumoniae, third one is the Moraxella catarrhalis, and Staphylococcus aureus, and others are forming. So Haemophilus is the first one as far as the adults are concerned. In children it is nearly Streptococcus as far as it is concerned, but here it is Haemophilus in adults. So as you can see that the most important clinical symptom is about the otalgia, that they will be having severe otalgia followed by a upper respiratory catarrh, and it can be also having cold, severe cold. There is a running nose and having severe pharyngitis. As you can see, there is going to be severe pharyngitis as a part of manifestation of this generalized disease, systemic manifestation like pharynx getting inflamed, and a patient might be having fever, irritability, GI complaints, and diarrhea sometimes may be associated with that, which should point out the clinician to see the ear once, so that we have to rule out the acute otitis media. Physical examination, one has to do the otoscopy. Otoscopy findings are clinching the diagnosis. You have to see the otoscope with the help of an otoscope. The ear has to be seen inside, and you have to examine the drum. It will be clinching the diagnosis. One has to remove the cerumen or detritus or wax that is present in the ear before getting an examination done, and never ever do syringing for the patient with severe pain, as it can be because of the acute suppurative otitis media, which is contraindicated. Syringing is contraindicated in those patients. The normal tympanic membrane is, as you know, it is a normal pearly grey with a transparent is like a curtain which can be showing the malleus and incus, sometimes inclusive joint and the middle ear structures. Initially an injected tympanic membrane, it is a bit reddish. Injected tympanic membrane is congested one, a bit reddish, cartwheel appearance can be present. As the exudates increase in number, there can be a bulge, and then can be generalized reddening of the tympanic membrane, which is a reddish tympanic membrane. And later on, because of pooling of secretions in the middle ear, it becomes like a pus-like cavity, empyema cavity, and then the tympanic membrane bulges outside, and it is ready to burst like an abscess. Acute perforation of the tympanic membrane, severe pain leading to decrease in pain because of the perforation and pus oozing out, is a clenching point of the diagnosis. So normal tympanic membrane which was there, which is oozing, which is bulging like this, and then leading to perforation, and then pus is coming out, it is a clenching diagnosis for ASOM. 10% of the patients require immediate intervention or immediate treatment. Most of the time they recover spontaneously. And if you take about the complications that are occurring because of this acute otitis media, the complications that are occurring in adults are more because of the acute otitis media. It is an important finding. In adults, the complications are more than in children as far as acute suppurative otitis media is concerned. and the complication rate nearly 0.25 per every lakh. 0.25 per every lakh, that means 1 per every 4 lakhs it can be there as a complication. Acute mastoiditis being the most commonest complication, there is swelling of the mastoid, and then it is another important complication is the facial paralysis. In facial paralysis, children with acute pain with severe pus leading to facial paralysis, once there is myringotomy, if you are going to incise the tympanic membrane, remove the pus, it is going to relieve the facial paralysis, acute facial paralysis in children, which is more common. Management options that you have to see whether antibiotics in the first 48 hours may not be useful, but it is empirically given, and sometimes analgesics are given for pain relief, which is also empirically given for pain relief, which has to be taken care of. And then nasal decongestant has to be done, steam inhalation promoting the drainage from eustachian tube till the level of the throat, so that there can be secretions pooling up, will be dislodged. So the most important thing is that the complication rate of acute suppurative otitis media is more in adults, even in the developed countries. That has to be kept in mind. And the complications in adults more commonly the mastoiditis. And the treatment with antibiotics is a question mark over here. It's a big question mark over here, whether you have to give it or not. You have to see. And thank you for watching the smell bell verbal cephalocervical surgical interesting understanding of the ENT head and neck, made easy in a manner that you can understand easily. Thank you for this is Dr. Smell Bell Verbal signing off from India. Thank you very much.